Good afternoon. My name is Kelsey DeClue with Columbus Regional Health, and I want to thank you for joining us again this afternoon for an update. It's been a while since we've been able to speak with you, so I appreciate you seeking the information and the update that our health system has for you related to COVID-19. So a couple of exciting announcements I have for you from our health system. First off, this week we were able to open what we call our CRH Heroes House, thanks to a valuable partnership with Volunteers of America. This property, which is located downtown on Washington Street, had been designated for the Fresh Start Recovery Center, which it will still be eventually. But with the stay-at-home order from the governor, that program has been delayed. And so volunteers across America generously offered that property for our workforce members that have been exposed to potentially COVID-19 or are confirmed positive COVID-19 and would like to kind of shelter away from their families and loved ones so as not to risk further exposure or spread of the virus. So at the CRH Heroes House, there are 17 units available to our workforce. Those are private little residences. There's also access to dining and kitchen facilities, as well as laundry facilities. And many of our local restaurants have reached out to provide food to those residents there. And so we're very thankful for this community effort that made this possible. Another great update we have is that thanks to a partnership with Mayo Clinic, we have enrolled in the convalescent plasma therapy program, which allows us to give plasma from people who have been confirmed COVID-19 positive and they have recovered from the virus and from the disease, and they are healthy and doing well. And that means that their bodies are producing antibodies, and we can take those from the plasma in their blood and give them to our most critical COVID-19 patients to help them aid in their recovery. And this has been shown on a national level, international actually, to kind of help improve their chances of recovering when they're at such a critically ill point with this virus. So earlier this week, we were able to give life-saving plasma to 2 patients here in our inpatient facility, which is just a wonderful program. There is an opportunity for those of you who did have a confirmed COVID-19 test and you have recovered. You can be a donor as long as you also meet traditional blood donation requirements. So please, 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 if you fall in that category, or if you're wondering if you fall in that category, seek more information. We have that information for you on our website, crh.org/plasma. Or of course, you can call our triage hotline at 812-379-4449, and our trained nursing staff will walk you through whether or not you're eligible for that. So far, we have had 11 donors reach out since we just launched this a few days ago, which is very exciting. So thank you to those people, and thank you for our community for the response. We've also had some questions about, from the beginning, as everybody knows, we've been at this for several weeks now, and from the beginning, how many patients have we treated that were COVID positive? And that number is a little difficult to find, especially on the outpatient side. We know on the outpatient side of things, there are, over 100 or more patients that we've talked to through either our triage hotline, our fever and cough clinics, or just through physicians within our network. And those people, they're obviously, sheltering in place, as we all should be, isolating and recovering. On our hospital side, our inpatients, right now, we have 7 positive inpatients. But from the beginning, we've had nearly 40 people come through our inpatient setting. 25 of those have been discharged and are recovering at home. And unfortunately, as we have reported in previous video updates, and as Dr. Niedbalski mentioned today, we have had some county deaths, and we have had inpatient deaths as well. But I just wanted to take the opportunity to give you kind of a snapshot of how we've been able to treat patients from the beginning, from our first positive patient to where we are now. And obviously that work continues. Um, as the governor announced today, as our communities, our state, and here locally, as we kind of look at this next phase of how we will slowly and in a calculated manner begin to get life back to normal as possible, to kind of reopen our communities, as has been stated. We just want to say that, of course, we are following those national and state updates very closely. Columbus Regional Health is doing exactly the same thing of managing our resources and figuring out what that looks like for us, working with our community as we have from the beginning on this. But I think it's really important for people to realize that you are the ones from the beginning who followed the guidelines to shelter in place, who followed physical distancing. You've been masking when you go out in public. Those of you who have followed these guidelines have made all of the difference for the way our health system has been able to handle this virus and preventing the spread, which is so, so critical to where we are at right now. So thank you for that. And please, please, please continue those efforts as you're going out in public, as things potentially start reopening. Currently, you're going to the store, those things that have been open from the beginning. Please continue to mask when you're in public, and please continue to physically distance. That's that staying 6 feet away from another person that's not a direct family member, because it's making a difference, and we really appreciate your efforts. Lastly, I'd like to say it's been kind of a scary time for people not wanting, you're following these rules and you're not wanting to go out in public if you don't have to. And maybe you've been concerned about when to seek medical attention, especially if that medical attention isn't related to upper respiratory symptoms of fever and cough. Please, please reach out to us. Stay in contact with your family physician if you're having any health issues at all, but especially if you're having emergency health issues. Please utilize 911. If you're having an emergent problem, please call your family physician if there's something that you've been wondering about, a health concern or a health issue. If you don't have a family physician, please call WellConnect, and our connection specialists can find a way for you to be seen either through telehealth, which is virtually, or if you would need an in-office visit. Our physicians are out there ready to serve you. Our hospital and our health system is here to serve you safely, and you do not need to be worried about being exposed to the virus or potentially spreading the virus if you've had it or if you're worried about that. We have very safe and effective ways to provide you the care that you need. So in closing, I just want to thank everyone on behalf of Columbus Regional Health for your efforts so far. Continue to stay safe. We appreciate you. Thanks.